Hi, Michelle. I'm Dr. Jordy. It's nice to meet you.
And my name is Michelle. My last name is Stewart.
What brings you to the office today?
I've been getting a headache. I would say about 2 weeks now, and it's been horrible. It's been...
Have you ever had headaches in the past?
Yeah, I did have headaches in the past before, but I don't know what's causing the headaches. This one just keeps going, so it feels like it's stuffed. It won't go away, but the pain is always there. I'll go to sleep, I'm fine, but when I wake up, I still have the headache.
Still have the headache. Okay, so it's been 2 weeks, headache every day, quite severe it sounds like.
Oh, terrible, yeah. Oh, I put a cold pad or a cold washcloth on my head, usually my forehead. Something with heat, I also tried that. It didn't work. I've taken Advil. That didn't seem to work either. It seems nothing is working.
Okay. And does the pain come on both sides of your head or just on one?
Both.
Both sides. And mostly in the front?
The whole front.
Whole front. Okay. And you've not had trouble with migraines in the past?
Yes, I've had those before, but they would come and go.
Okay. And in the last few weeks, have you had any cold symptoms? Any runny, stuffy nose, sore throat, cough?
No, not just the headache. That's all.
Okay. And how much caffeine do you use?
I drink a little bit of coffee, maybe 4 or 5 cups per day.
Okay.
I drink the pop also, but that still seems to be not the solution for the headache.
And has that changed, the amount that you've been drinking lately?
Yes, I've been trying to drink a lot less.
Okay.
Same with coffee and with pop, trying to drink a lot less.
Okay. And have you had a fever lately at all? No.
No, not that I'm aware of.
Okay. Sounds good. Have your teeth been hurting?
No.
Nothing that way?
No.
Okay. Sounds good. And in your family, did anyone in your family have headaches? In your mother, your father, or any siblings?
Mom and Dad, yes. It seems like I've been given that trait. I've asked my mom, you know, what's wrong? Why do I get these headaches? And they both, actually Mom and Dad both have said they don't know why.
Okay. Good. So, and I understand that you've recently had some lab work and that your blood sugars have been a little elevated?
Yeah, it's been pretty high, staying on the high end, yeah.
Okay. And how has your weight been? Let's see, it looks like it's...
Yep, about 325. It's been the same. That's been the same weight I've had for a long time.
For a long time, been stable. Okay.
Yeah.
And the only medicine that you take, it looks like Monopril, 10 milligrams once a day?
Yes. Mm-hmm.
Okay, and then ibuprofen once in a while?
Yes, but it doesn't seem to work. I've tried Monopril, 10 milligrams for the headaches.
Okay. And you're allergic to penicillin also?
Yes.
Okay. Have you been under much stress lately?
Yeah. Headache and anxious. I get more anxiety attacks with the headaches, trying to relax a little bit, but I get even more anxious and why it's happening.
Okay.
I'm not sure exactly why the anxiety starts up, but yeah.
Yeah. Are things going okay at home?
Yeah, it's been good.
Okay. Okay. Excellent. Well, I'd like to do a quick exam. So let's have you move over to the exam table.
Sure.
Right over here. Okay, Michelle, I'd like to examine your eyes. And for this, I'd like you to leave your glasses on. And if you
Okay, that's fine.
And if you could look over at one of the papers in the corner there for me and just stare right at them. Good. Excellent. And we'll look at the other side. Good. Okay. And look right at my nose. And follow this light with just your eyes. Good. Next, we'll look at your ears. Has your hearing been okay?
Well, I can't hear anything.
What am
I'm
I
deaf.
thinking? Okay, very good. Did you ever have surgeries on your ears?
No,
Okay. And open up wide. Good. Good. I'm going to tap on your face. So let me know if this hurts at all. Is that okay?
Mm-hmm.
That's okay? Okay. Open your jaw for me.
Wait. That. When you tapped on the forehead, that hurt. When you told me to tell you if it hurt.
A little bit up here?
Yeah.
This side?
Yep.
Yep. Okay. Both sides or right or left? Both.
Both.
Okay. Open your jaw and close. Good, good, okay. Do you feel both of these?
A little bit.
A little bit? Both of these?
No.
No? Both of these?
No.
A little bit. Show me your teeth. Puff out your cheeks. Close your eyes real tight. Good. Turn against my hand. Good. Turn against my hand. And shrug your shoulders. Good, good. Squeeze my fingers, both sides. Pull me towards you. Oh, good. Push me away. Oh, good. Elbows out your side. Hold them up. Good. Step on the gas, both sides. Press down. Good, good. And point your toes up this way. Hold them up there. Oh, point your toes real high. Up like this.
Okay.
Good, good. Okay. And let your arm just relax on your lap. Yeah, right there. Good. And right there. Good. Good. I'm going to listen to your heart.
Okay.
And you can just breathe relaxed for me. Good. Take a deep breath. And again. And again. And again. Again. One more time. Good. All right. So Michelle, I would like to get some more testing. I would like to get an X-ray of your sinuses to see if you have some fluid in there that may indicate a sinus infection. So we'll arrange that test for you. There are some other things I'd like to talk about with you, though, as well. Your blood pressure is quite elevated today, and it sounds like your blood sugars have been increasing. In the long term, these are things that are going to affect your health. They can eventually lead to things like heart attacks and strokes and things like that. So in the short term, I know the headache is giving you a lot of trouble, but in the long term, these other things are definite concerns for you as far as keeping yourself healthy down the line. I'm glad that your weight has been stable, but I do need to have a serious talk with you about losing some weight in the future. Eventually, if your weight stays where it is, we'll have to put you on more medicine for both your blood pressure and, in all likelihood, for diabetes in the future, to help keep your blood sugars down. But the good news is if I can help you lose weight in any way, we can probably avoid that. And I think that would be a good thing. Right now, I think your blood pressure is probably a little elevated, because you're uncomfortable from your headache. But in all likelihood as well, I think that the Monopril that you're taking probably is not at a high enough dose. So I think we should change your medicine dose a little bit today to get better control. Interestingly, some people do find that they do better with their headaches after they're on a higher dose of the blood pressure medicine. Many blood pressure medicines are good preventive treatments for headaches. So
I hope that'll reduce the headaches. It's been a terrible 2 weeks for me. Mm-hmm. I'm hoping that with the higher dose, I'll actually feel a lot better. Yeah. And I think once the results are back from your X-ray too, we may have some other treatment options for your headaches as well. So what I'd like to do now is I'd like to hear about that too. I hope that happens. Yeah, that sounds good. What I'd like to do is get the testing, and we'll do some blood work as well, and then I think we should meet back and we'll talk more about some treatment options that we have for you. All right. Sounds good. Is there anything else I can help you with today? If my blood sugar is high, I'd have to just continue to lose the weight. I don't want the diabetes. I don't want to give myself the insulin shots. So fighting with myself to make sure that I am going to get that weight down, then not have the diabetes, and avoid more of the sweets that I tend to eat. Drink more water. Avoid the pop. Avoid the caffeine. Yeah, pop is a very difficult thing because it tastes good, but it's not really food. And the sugar that's in pop directly contributes to those high blood sugars. For most people, the sugar or the calories that they drink contribute a significant amount to their diabetes. So that if we can find other things for you to drink that you enjoy, I think that'll have a definite positive benefit for you. So I'm wondering, is there a special kind of diet pop? Would that be, is that a lot less? Oh, there's no special diet pop. The diet pop doesn't have the calories that normal pop does. And in the, as a transition, switching to diet pop is probably a good thing. Eventually, though, I'd like to see you drinking, just natural beverages, things like, water, occasionally some milk if you like milk, occasionally some juice. But water is your friend. I'll do my best. I'll try and do the water. Sounds great. Do the water, yeah. Well, let's get a few of those tests going and then we'll meet back. Good. Sounds great. I look forward to coming back and seeing you. Sounds great. It's been a pleasure. Same with you.